Well, Lori, I know that sometimes we have listeners that are just tuning in for the very first time. So would you talk about what the First Step program is at the hospital?
First Step is a inpatient medical stabilization service for those who have become dependent on pain medication or alcohol.
Is there any age limit?
At the hospital, we accept patients 18 years and older.
Okay, so it can go, because it could be somebody that, you know, in their 70s, 80s.
And ironically, that's what we've really seen this month, is the older population, the 60 and up, which I don't think 60 is old, but
Thank you very much.
But when you're trying to find someone treatment for after First Step, they do consider that a little older, but we've seen a huge increase in older men.
You think it's something where they've come in, they've had some sort of procedure or surgery, that kind of thing done, and kind of gotten hooked on the pain
Well,
medications?
Ironically, they've actually been VA vets. And we've had a huge, seen men, like I said, 60 years and older. Now that's this month. Next month we could have all females in their 20s. You just never know.
Yeah. So how long has the program been running now at the hospital? Couple of years?
I'm going to say, well, gosh, no, we've
3
in 2008.
Oh, okay.
Yes, it was September 2008.
Wow, time flies.
I know.
Yeah.
I think I've had two children since then.
Yeah, I was going to say.
The show has seen me grow and get smaller and grow.
That's right. Oh my goodness! It just seems like it was yesterday when we had the kickoff
and
for
we've grown from 3 hospitalists to, gosh, to 6 or 7 now. So our program has really grown through the years.
Yeah. Can you go step by step for somebody that's watching today on, let's say they themselves have a problem. So if they're watching today, what is step by step? Who's a good candidate? What do they need to do? Once they are in the hospital, what's done? Can we kind of go through all of those?
Initially, if you feel like you have a problem, you know, or if you just have questions you want to see if you do meet the criteria to come into the service, are you dependent on pain medication or alcohol? If you stop using, does your body have a physical sickness? Is it
a reaction? Yeah.
Or do you get nauseated? Do you have tremors? You know, there's so many different symptoms. If you feel like that, yes, you do, obviously call. We check your insurance. We accept Medicaid, Medicare insurance, as well as private pay.
Okay.
That's an option. And a lot of people do like to do that because either their deductible is astronomical, or they just don't want to put on their insurance, or they don't have insurance, so they are able to pay cash. We kind of get just a basic history, you know, what the problem has been, how long, the amounts used, and then if they take daily medications, because that's very important. We need to know a history. You know, do you have high blood pressure? Some things that we can expect. We take this information and then we give it to the physician that is admitting that day.
Okay. And this is a hospitalist?
This is a hospitalist.
Right. And I'm going to back up for just a second on that, because a lot of people in the course of conversation I've found don't understand what a hospitalist is. And they are physicians in the hospital every day that basically, let's say you have a primary care physician who's recommended, then they take their role, and any information that the primary care physician needs to receive back goes back to that office if requested.
And when the patient is discharged, they go back to their primary care physician. The hospitalist does not see patients outside of the hospital, and that is sometimes confusing because people will be discharged and they'll call and say, I need to make an appointment with Dr. So-and-so. Well, Dr. So-and-so only sees the patients while they're here. We've got to get you set up with the primary care. But one of the most important steps of the whole process is if they're going to go to a treatment facility, we need to get that set up. The aftercare plan is so crucial.
Sure, because this is it really is just the first step on the road to recovery, to getting your life back under control.
Because it's a lifelong, you've got to restructure, you have to, you know, retrain the mind and the body. So aftercare is very important. Are you going to go to counseling? Are you going to see, you know, attend support groups? Or are you going to go to a treatment facility? Facilities, they're 30 days and can be up to a year long. So it's really important that we have the aftercare actually set up before
the person even comes into
before
the
the
hospital.
stabilization service.
Okay.
Yes, we can. We want to be a very smooth transition. We can schedule them within 24 hours. So we want to know, is the next place
All set up?
Yes, all set up.
And now, does the patient set up that aftercare, or do you help them do that?
We do assist. Gosh, I travel Arkansas, Missouri, so we have a binder combined of lots and lots and lots of resources. We will give 20 phone numbers out at a time, and then they have to be responsible for calling because they know themselves the best. In these facilities, they're going to ask personal questions that we can't answer.
Right.
Now, if the facility needs information from us after the patient has come in, then they sign a release of confidential information, and that gives us permission to give them medical records.
Right, because all of this information is kept confidential.
It's all confidential, even a phone call, just a phone call asking for support group information or counseling information. Any call that comes to the office is confidential.
Right, right. There's still such a stigmatism with people thinking there's something wrong with them. If I were stronger, I could beat this on my own,
or the spouse saying, just stop.
Yeah.
If you loved me, you could just walk away.
Yeah.
Not always the case.
No, because there's physical ramifications on all of this,
There
as you said, with the withdrawal symptoms. And is it the withdrawal symptoms themselves that the hospitalists take care of in those 3 days?
That's all that we focus on is
Okay.
their acute medical. Because the first 3 days you feel the worst. You do have restless leg, vomiting, diarrhea. You don't feel like going to meetings and support groups. And our service, we don't have that type of counselors or psychiatrists. That's not there. We're only a medical stabilization, a medical stay.
Right. You're helping them get over that rough spot.
So then they can continue.
That's great, great program, and we started in 2008, and I know a lot of people aren't aware that we have this. It's right in the hospital.
There's lots of people who still are not aware of the service.
Which is why we have you on the show and say we need to get the message out. If you have a loved one, if you yourself are facing some challenges, and it's time, that it's time to make a change, this is how to do it. What's the number?
It is 870-508-7590, and that is our direct line.
7590.
And if we don't answer, please leave a message. There's only 2 of us in the office, and so we will return your phone call.
And is this a separate unit, or are folks that come in, this is all just kept private as much as possible, is that correct?
Yes, it is kept private. Now, all the nurses in the hospital have been trained, so every floor is equipped to take care of the patients.
Wonderful.
Yes.
Yeah. Yeah. And then the hospitalists know exactly what they need to do.
Fabulous hospitalists.
Yes, they are. They certainly are, and I know they. And this is a program that keeps our hospitalists busy. And you were saying that you yourself travel into Missouri and all over Arkansas, but people are coming from even further away, I understand.
We have patients that come from Oklahoma. We've had patients that have come from Illinois, Chicago area, who has, they have a family member, so they can come, stay, with their family member after they get out of the service. So,
I know a lot of different patients that you've talked about in the past, no name mentioned, of course, but just different patients that have come in, that it's almost as though they can go ahead and leave work on a long weekend, come and get stabilized, then get themselves into a program, and don't feel as though they've taken, they're afraid of losing their jobs, they're afraid of losing their spouse, but they want to keep it because it's right across the board as far as who this could affect, isn't it?
It is.
It's not, income has nothing to do with it.
Has nothing to do with it. We've had, a realm of, from nurses to physicians to pilots. I mean, it's not just.
It's straight across
for
the board.
everyone.
Yeah. So, what else can you tell us that's going on with the program? I know that now you go out into the community, and what are some of the things that you're sharing with community members? What are you seeing the most of coming through the doors of the hospital, and then you share that with other community members as far as, you said drug and alcohol, painkillers primarily, and then alcohol. Anything else you're seeing a lot of?
Right now, of course, each month is different, but right now it's alcohol. Next month it could be pain medication. Yeah. No rhyme, no reason. And we look at like the end of the year, we'll think, oh, probably 75% people that came in were struggling with alcohol addiction. And then it ends up being, it was like 50-50. Yeah. So. Yeah. And I know one of the things that we've talked about, it's a shame that we don't have anything in this area. You get a lot of calls probably about people with methamphetamines. We do. And that is not something you deal with. Okay. Yes, we do not deal with that. Right. We need to take a short break. Let's get into that a little bit more when we come back. We'll be back right after this short commercial break.